No, obviously we did a spine surgery. When did we do the spine surgery?
The
For the lumbar spine, the 1L5S1, the first surgery.
okay, that was October, the end of October 2018.
So about 2 years ago.
Yeah.
Now, did that surgery help you?
Oh, immensely.
So what were your symptoms before that surgery?
Severe low back pain. I couldn't really
Okay.
do much.
Yeah, and then we did that surgery about 2 years ago.
Mhm.
How long did you stay in the hospital after that surgery?
One
One night.
night, yeah.
Yeah,
And then I could do stairs and walk and
Mhm.
everything.
good.
Mhm.
But that, unfortunately, that didn't end up your problems.
No, I had more,
More problems.
and then my neck.
Yeah, but let's talk about the lower area.
okay.
In the lower area, we know that people who have spinal fusion, 43% of the people end up with the second problem, which is the sacroiliac joint, where the spine and sacrum are connecting to each other.
Mhm.
And obviously in younger women, especially people who have given birth, that problem is probably even higher. Because actually,
Definitely.
because actually the sacroiliac joint, the only time that it moves is when a woman is giving birth. And during the birth, actually, an enzyme come and loosen that joint,
Oh.
so it can move more because nature wants the baby to
Yeah.
have more space to pass through.
Mhm.
And that happened with you, right? You
Oh,
have
big time.
given birth, and then
Yeah.
so you had this sacroiliac problem. And do you remember how we diagnosed sacroiliac joint with you? Do you remember?
Yes, the injections, and
Yeah.
they only lasted like 2 days.
2 days.
And then I was
Mm.
right back to the same old pain.
Well, first we provoked it. We
Mhm.
saw that if we provoke it, the pain gets worse. But then we put a needle in and we numbed it up.
Yep.
And it was good while it was numb.
Yeah.
And we put steroid in, but that didn't really help you. So we diagnosed it, but we couldn't fix it with non-surgical means.
Correct.
So we decided to go and fix it with a surgery.
Mhm.
When did we do the sacroiliac fusion?
It was June 17th or 18th, around there.
So about 5 months ago.
Yeah.
Now I'm going to turn around and first of all show this is your spine, and we did first we did the L5S1 fusion, and look at the bone is solid there,
That's awesome.
growing, no problem at all.
Mhm.
And as well bone in the back, look at that, growing very nicely here.
Mhm. I can
And
feel it.
yeah, and that's so. And here, bone is growing solidly after
Mhm.
our minimal invasive procedure. And then 6 months ago or 5 months ago, we did that sacroiliac fusion. And if you look carefully here, as well, bone as well growing in the sacroiliac
Mhm.
joint. Bone, I use these screws. That bone grows inside and outside. There are some plugs there. They're like nail, but I believe screws are much better than nails.
Yes.
Yeah.
Yes, because they can grip. They can
Yeah,
grip the bone.
exactly. That's
They're
common
not just gonna
sense.
slide.
That is common sense.
Yeah.
But on top of that, the screws that I use, they have a big hole inside, so bone can grow inside and
Oh,
outside of the screw.
Awesome.
So we are getting better with that. Almost every year we are getting better with this
Yeah.
technology. Now, we did the surgery 5 months ago. How did that go?
Awesome.
Yeah,
I think I was only in the hospital one day with that.
yeah, and
4 hours
Yeah,
you
and I almost
4
know
hours
that
in the
from the
hospital.
time she
That-
woke up till we were gone.
That
Yeah.
pain was gone almost instantly, though. Like
Okay,
I've been suffering for 10 years.
yeah. Now, we asked you not to put pressure on that
Yeah.
side for a while. How long after the surgery could you put pressure on that side?
Oh, I don't even think it was that long. Well, maybe a month.
A month? Okay,
Yeah.
okay. Now,
I
as
took
well-
it easy still, but
which is good.
yeah.
So these are the statistics. We know that even people who they never have spine problem, if they have back pain, 23% of them actually the problem is not spine, it's the sacroiliac joint. If you had a surgery in the spine, that jumps up to 43%,
Oh,
meaning
wow.
almost half of the people have spine problem after that if they have back problem. But more importantly, we know that especially the way we do the surgery, the way we did one small incision less than an inch, putting 2 screws across the way we did it here. We literally put a 1-inch incision on the side of the hip and then put 2 screws because one screw is still allowed to rotate around the first screw, second screw stop that. We know that actually in half of the cases that once we fix one side, the other side, because you use it, the side that's
While
fixed
you're
more,
healing.
the other side get better. In half of the people, unfortunately, it doesn't get better. And now you unfortunately belong to that group of people that the other side didn't get better.
Yeah.
So, and you feel that the other side is bugging you more.
Oh yeah, definitely.
And but I think as well you told me that you noticed that even within few weeks, the side that we did the surgery was better. Can you repeat that what you just said to me about the side that was that we did the surgery and so on?
Oh yeah, just within a couple weeks after having the surgery, she said that it felt a million times better, even though she was still healing, and that she could feel the other side was actually was actually the worst problem. Then, now that she had the one side done, the other side
and
became just as much of a problem.
And that makes sense because we do a surgery on one side, do you have to use the other side? And
Yeah.
unfortunately, in your case, even though we gave it enough time, the other side is not better. But
No.
that is a day surgery. We half an hour procedure, 40-minute procedure.
Yeah.
That this is fixable. You don't have to.
You don't have to suffer anymore.
Exactly. And that is the point.
In suffering.
And there's no point in suffering. They say pain make you stronger, or
No.
what doesn't kill you make you stronger. That's nonsense.
No, it's
Just make you
if it gets
grumpy
worse
and-
worse.
Yeah.
Yeah, it destroys life.
Yes.
And
Yes.
the problem with the sacroiliac joint is that still most of a spine surgeon, we don't even know about that, and they're not trained to do that. And unfortunately, you went through that process that they told you is nothing wrong, go away.
So there's nothing wrong with me. I'll just send you to a pain doctor.
Yeah,
And I said that's not the answer I was looking for.
yeah.
I'll go see Dr. Abbasi.
Well, thank you for coming to me, but I wish I could say your situation is special or you're unique.
Yeah.
People just suffer with this for years because we look into the spine, we don't see anything wrong with that, and the knowledge hasn't penetrated to our specialty that many times the spine is not where it is painful.
Yeah.
Not the sacroiliac joint is, and we are able to look here again. You see the rugged edge of the spine, the dark spot there, and more importantly, we numbed it up multiple times. Every time numbed it up, the pain did go away. And the fact that the pain on the other side went away within weeks after that surgery, that proves
Yeah.
that you are right, and people who didn't believe you, they're wrong.
Yeah, exactly.
Okay.
I'm glad I pushed it.
Yeah, and I'm glad you did that too. And this pain destroys lives, literally.
Definitely. You can't do anything.
Relationships, yep.
Can't
So-
play with your kids.
Yeah.
And
Nothing.
with an 8 and a 10-year-old, you need the new life,
Yeah.
Be able to move and do stuff with them before it's too late.
Well, I think that we start to understand this better, and more people are getting trained, but still, most of us spine surgeons are unfamiliar with this. So
There's so many-
I'm hoping this video changed that.
Me too.
Okay. Hey,
Then you can save someone's life maybe.
well, yeah, that is in
Because
some
there's no
cases.
point
it is.
in living like that.
And
if
you
you
see,
can get it fixed.
you just point to in the right direction.
Hmm.
If your life is just full of pain, that is, many of my patients tell me, I
That's
don't
not-
want to live like
No,
this.
Yeah.
Yes.
there's no point.
Well, thank you so much for the interview. I really appreciate that.